I came from a family that was very much in medicine, so I guess I've always been introduced to that. My father was a chief of surgery at University of California, Irvine, so even from a young age I was tagging along and had summer jobs working in the operating room, cleaning up the instruments and mopping up the floors and things like that. And then went to college trying to figure out what I wanted to do. Was taking biology, in those classes, and then to pre-med, and then that was at Stanford University, and then went to medical school at UC San Francisco, 4 years there, and then it was a circuitous route into spine surgery. I was originally going into plastic surgery, and a difficult program to get into. I was in that program, and the chief of plastic surgery asked for one of the residents there to spend some time with the orthopedic surgeons because he wanted to get a better background in taking care of hand fractures, hand things, bone issues. So I went and volunteered to do that, and it was fascinating. Orthopedic surgery at that time was the fastest growing specialty in medicine, and the technology going along with it was incubating more companies than any other field of medicine, and in fact any other field if you looked at the stock exchange and the companies. So it was just very fascinating. So I stayed in orthopedic surgery, but I always liked the fine surgery that plastic surgery was. And in orthopedic surgery, you've got big cases where you're cutting bones and it looks like a blue collar, hard hat sort of environment, hip replacements, and that was okay. But then there was this infant field that was in its infancy, spine surgery. And it combined both of those elements, really fine, precise surgery, as you can imagine, working around nerves and blood vessels, but also some real mechanical things, putting rods in to straighten out scoliotic curvatures, kyphosis, fractures. So went into spine surgery, but there was a problem. In those days, which was in 1985, there were only 5 spine surgery fellowships. So in other words, when you finished with general neurosurgery, you're not really qualified to do spine surgery. That's mostly working on brain. When you finish general orthopedic surgery, the same thing. If you really want to be a specialist in spine, you need to do an additional year. That was called a fellowship. But there were only 5 fellowships in the entire United States. And unfortunately for me, none of them were on the West Coast. There was none at Stanford where I was. There was none in San Francisco, if you could imagine. So I was fortunate to get into one of those spine surgery fellowships at Baylor University in Houston, Texas, and did that for a year. And then the director of that fellowship said, you should really go to Europe because a lot of the developments in spine surgery are coming from Europe, and we're pretty much behind here in the United States, so I'll send you there, I'll set it up. So they sent me on an additional fellowship program that went through England and France and Germany, which was a great experience, but I learned from the pioneers of spine surgery, the guys who started pedicle screw fixation, deformity. And then I came back to Stanford and worked there, and then was contacted by the hospital here in Reno that wanted to start a spine surgery program like we had going at Stanford, and a multidisciplinary clinic. That was the new thing then, is to have a multidisciplinary spine clinic. In other words, not just surgery. Not everybody needs surgery. In fact, maybe only 10% of people need surgery, but treated with pain management, psychology, chiropractic, physical therapy. So that's what we call multidisciplinary. We're bringing that all into one cohesive unit. So the hospital asked me to come up here and start that clinic for them, or start that sort of program. And that's what I did. So that's the beginnings of Sierra Regional Spine Institute. So the first doctor that I recruited was a physical medicine rehab pain specialist, and together we built that up, and then added another surgeon pretty quickly, Dr. Kip, and then more physiatrists over time, and other surgeons. So we are the original multidisciplinary spine clinic in Nevada. We're definitely the oldest one. A lot of experience that comes with that. And because of the culture that we set up, we've been able to keep people together for now, going on 30 years. Most medical practices, partners come and go, they have falling outs. We've been able to keep the original partners together from the inception, which is saying a lot. And a lot of our employees have worked here for over 20 years, so there's a lot of continuity. And it's because everybody buys into the mission, which is, here's what it is, real simple. I came from the university, all that high-tech care and new instrumentation and companies, but we wanted to provide the type of care that you would want for yourself, more importantly for your family, your mother, sister, daughter. So it's high-tech care, old-fashioned caring. So we're not going to run a big factory clinic with 50 people in the waiting room and a bunch of exam rooms. It's going to be a one-to-one basis. Every patient gets as much time as they need, and the treatment program is customized to them. So that's the old-fashioned caring, the one-to-one talking. High-tech is we've kept our university connections. We teach for the university, for the medical school. A number of us, including myself, have traveled around the world lecturing, teaching other doctors about some of the techniques. Dr. Kipp brought the first outpatient spine surgery here to Reno, Nevada back in 1996. Reno isn't thought of as a cutting-edge place in medicine, but because of our connections with the university, we were able to bring a lot of firsts here to Reno because of those connections. First outpatient spine surgery, first artificial disc replacement surgery, first interbody fusion with cages, first kyphoplasty, a really novel paradigm-changing technique for treating osteoporotic fractures of the spine.